Blood volume analysis with Daxor's BVA 100. Daxor's FDA-cleared BVA 100 provides direct intravascular blood volume measurement with 98% accuracy in approximately 60 minutes or less. This video outlines the essential steps to conducting a blood volume analysis and is intended for medical personnel trained to establish venous access as well as those licensed to inject a radiopharmaceutical. The semi-automated BVA 100 system comes with almost everything you need to perform a blood volume analysis. The convenience kit is pre-packaged with a venous access and blood collection kit. You will need to supply pre-filled single-use saline syringes and alcohol wipes. Ensure an adequate amount of pre-filled syringes are available for the test. After the patient fills out the medical history questionnaire, measure the patient's height and weight with their shoes off. Remind the patient not to cross their arms and legs as you place them in a supine position for about 15 minutes to allow for equilibration before starting the procedure. While the patient is resting, prepare the injectate and collection kit. You don't need to wait for equilibration if conducting an inpatient blood volume analysis and the patient has already been supine for 15 minutes. For heart failure patients, please consider a 30-degree incline versus a supine position. Open the convenience kit that accompanies the Volume X injectate dose and place the appropriate labels on the test tubes, being careful not to cover the viewable window opposite the label. Establish an IV. A 20-gauge shielded IV catheter is preferred. Smaller gauge catheters or butterflies can be used, however, they may be problematic as using them may lead to hemolyzed blood samples. Attach an IV extension set with the check valve to the IV catheter. Tape the IV extension to the patient's arm. For more information, please visit us online at www.daxor.com.